Migraines and headaches. Migraines and headaches wreak havoc on a sufferer's daily life. While a migraine is a headache isn't always a migraine. Migraine attacks typically include headache of moderate or severe intensity, one-sided, and pulsating. It is aggravated by routine physical activity with a duration of hours or 2 to 3 days. Nausea is the characteristic most associated with migraines. Attack frequency is anywhere between once a year and once a week. In children, attacks tend to be of shorter duration and abdominal symptoms are prominent. Types of migraines. Please pause the video here if you would like to read the text in the picture. Migraine with aura, complicated migraine. About a quarter of migraine sufferers experience an aura before or during a migraine. An aura comes in several forms and can impact vision, touch, speech, and even smell. Many consider their auras to be a warning sign that a migraine is imminent. Migraine without aura, common migraine. Most migraine sufferers experience migraines without aura. This type of migraine is often accompanied by severe pain along one side of the head, light and sound sensitivity. However, these migraines don't come with an aura and no warning that one is imminent. Hemiplegic migraine. While a hemiplegic migraine is rare and doesn't always include pain, its severity and other symptoms compare with stroke symptoms. They are sudden, severe, and cause weakness on one side of the body. Like other migraines, it can last for hours or weeks. Retinal migraine. A migraine that causes temporary vision loss is a retinal migraine. While the symptoms may not last, it's important to see a specialist if you suffer from this kind of migraine. Chronic migraine. Sufferers usually experience migraine pain more than 15 days a month. Migraine treatment. Migraine requires a diagnosis by a physician. While treatments are available for migraines, it can take time to find one that works for you. Everyone has had a headache, and a migraine is a different type of pain. Combined with variable duration and symptoms, migraines are more than just a headache. Missing work or events due to migraine adds to the stress of the condition. Please pause the video here if you'd like to read the accompanying text. What are headache disorders? Headache disorders characterized by recurrent headache are among the most common disorders of the nervous system. Headache itself is a painful and disabling feature of a small number of primary headache disorders, namely migraine, tension-type headache, and cluster headache. How common are headache disorders? Globally, it has been estimated that prevalence among adults of current headache disorders, symptomatic at least once within the last year, is about 50%. Half to three-quarters of adults aged 18 to 65 years in the world have had headache in the last year, and among those individuals, 30% or more have reported migraine. Cluster headaches. Affecting approximately 1 million Americans, cluster headaches are often seasonal, include pain around the eyes and temples, and radiates toward the neck. This type of headache impacts fewer people, however, they are severe and occur in clusters. What is the burden due to headache disorders? Not only is headache painful, but it is also disabling. In the Global Burden of Disease Study, updated in 2013, migraine on its own was found to be the sixth highest cause worldwide of years lost due to disability. Headache disorders collectively were third highest. Tension type headache. This headache is described as pressure or tightness, often like a band around the head, sometimes spreading into or from the neck. Cluster headache, or CH. Most people developing CH are in their 20s or older. It is characterized by recurring up to several times a day, brief but an extremely severe headache, usually focused in or around one eye with tearing and redness of the eye. The nose runs or is blocked on the affected side and the eyelid may droop. CH has episodic and chronic forms. Medicated overuse headache, MOH. MOH is caused by chronic and excessive use of medication to treat headache. MOH is the most common secondary headache disorder. It may affect up to 5% of some populations, women more than men. MOH occurs by definition on more days than not, is oppressive, persistent, and often at its worst on awakening. Treatment. Appropriate treatment of headache disorders requires training of health professionals, accurate diagnosis and recognition of the conditions, appropriate treatment with cost-effective medications, simple lifestyle modifications, and patient education.